I would like to present my case clinical experience with the new airway clearance technique. It's not so easy to speak after Professor Sands, but I would like to present some our experience from our clinic and from our Motol University Hospital. Please, the next slide, please. So I prepared two patients. Patient number one is a female born in 1980. Since 1982, she was monitored for CF. At the first slide, you can see the normal history of a CF patient. And from the family history, you can see both parents of my patients are doctors. She is also a doctor. Her specialty is gastroenterologist, and she's very happy because in 2008 he stayed like a mother of a 10 years daughter. The casuistic is terminated from May 2019. And please, next slide. At the first part of slide, you can see the normal treatment for CF patients, which is standardized, and ACT was also standard. We can do the twice. She did twice a day during the workshop during the week of the week. The next slide, what you can see is inform you about the spirometry and saturation. Saturation before Simeox was between 93 to 95% SpO2, and before the Simeox, you can see that the FEV1 to FVC was just only 73, and after antibiotics was higher in 80%. 6 weeks when we started with Simeox, it was in June 2019. We started with the classical method of working with Simeox, and with the improvement, as you can see on this slide, is also very important. The most important is the last line, FEV1, FVC, where we can see 84% after 6 weeks with Simeox. And after 10 weeks with Simeox, there is 111%, and saturation with Simeox was between 97 and 99%. This is absolutely, at this moment, I am not in contact due to coronavirus with this patient personality. We are speaking with, we have a session of airway clearance with time phase or with Skype and so on. Immediately when she will be able to come to Prague, then we will have appointment with the practical Simeox. But she lives 160 kilometers far from Prague, and it's not so easy for her to visit me. This next slide will show you the patient number 2, which is very, very significant for us, because this girl was born in 2005, and she has primary ciliary dyskinesia. At the beginning of his life, she was absolutely fine. Once sinusitis, twice pneumonia, but nobody was careful of PCD. The next slide, please. In 2008 was from 2013 to 2014. You can see a slowly progressive of PCD, and also, what was very important for us that there was a bronchoscopy, which was did in the beginning of this progressive diseases, and we can see the results: chronic bronchitis and tracheomalacia. The next slide, please. Yeah. Critical deterioration of condition. At the beginning, on 2018, there was a deterioration of clinical condition. She lost weight, the desaturation was increased, infiltrate left basal and retrocardial. The bronchoscopy was absolutely terrible for us, severe chronic bronchitis with purulent secretion. And it was at the beginning in this year. At the end, in the autumn of 2018, there was a terrible exacerbation, desaturation with the needs of oxygen therapy, severe chronic bronchitis with purulent secretion. And the first was on microbiology was results with exophiala dermatitis, which was very time-consuming for the treatment for this pathogen. And after a month, again worsening clinical condition. The next slide, please. In January 29th, there was a consilium for this situation of this female, and you can see that the treatment with combination of antibiotics and antifungals was just quite not so satisfied, because she had 3-time bronchoscopy. And at the beginning of the 2009 was absolutely terrible results. Also, well sensitive was exophiala dermatitis to Vancomycin nasale. So the next slide, please. Yeah, there is RCT, which was done in November 2018, and you can see that the down lobes and low is very damages, and it was absolutely strictly asked. We were strictly asked from physician, what are you doing? What you can do for this patient for more intensive ACT, and what will be the next step of ACT. Please, next slide. So the next 3 slides will show you the bronchoscopy results and the bronchoscopy findings. Please be very careful of this picture, because this is the picture coming from November. Then Professor Pohunek closed the conclusions: severe bronchitis, chronic bronchitis with significant secretion of purulent mucus. The next slide will show you the next bronchoscopy 3 weeks later, and then you can see a lot of mucus. You can see absolutely closed airways, and also during the bowel was confirmed that exophiala dermatitis will configurated bowel culture. And the last picture of bronchoscopy is absolutely terrible. It is from January 3rd, 2019. She spent Christmas and New Year at home, and she absolutely ignored ACT. Yeah, you can see how damaged the airways full of mucus, full of purulent mucus are. So what to do with this case? Next slide, please. During the last bronchoscopy, the physician did sanction, and you can see Please, could you do the picture in the more detail for the whole display? Yeah, thank you very much. You can see how dark and how thick are the mucus and how full airways are with this mucus. Next slide, please. Yeah. So consultation for expertise, we ask the eventual resection procedure and its extent. Resection procedure is not recommended because it would be greatly limit for possibility of thorax lung and in the future, which will be very extremely complicated and very risky. So, and then you can see another treatment coming from a pediatric pulmonologist, and the request from this team, pediatric pulmonologist, was intensified ACT, more intensive ACT as essential in this time. Next slide, please. Yeah. We started with conditions September to October 2018. We did AD with a strong cough control due to respiratory muscle fatigue. From November to December, we do another standard physiotherapy. And in January 2019, we decided to use the Simeox, which was in hospital. In the next slide, I will show you how was our physiotherapy, how to improve airways hygiene. We did Simeox twice per day with physiotherapists, and once she did it alone. She used inhalation, exhalation with shaker plus support, but only very soft and very fine exhalation. In January 29, we started with Simeox. She was very afraid. She was very refusing Simeox because she wasn't in so not good condition with psychologists, with physician condition, and it was a lot of discussion how to use, and we had to very explain patients how to use Simeox and how that the Simeox will be helpful for her. So. Next slide, please. So we started 29 when it was just a short lesson. The next day we continue intensive ACT with using Simeox, training a leading Simonka to work independently with Simeox. The next day she was very fine and breathing is already much more powerful, reaching and prolonged exhalation and a continuous inhalation with prompted to deep breathing. ACT with Simeox, we started, every lesson was 4 per 10 drainage exhalation with this power you can see. And the third, it means just only 2 days when Simonka used the Simeox, she is calmer and more cooperative with breathing with Simeox. Please, next slide. So in February, and this regime, we did the ACT for next 4 years, 4 weeks, sorry, 4 weeks, and Simeox was used in this regime. And when a physician thought that Simonka could goes home. So the close and the recommendations from home care with Simeox was time about 1.5 hour, total 60 breaths with Simeox support, and to be objective for the treatment, I have to recommend that I have to say that from February also an IV was help her, and very important is that non-tuberculosis mycobacteria examination was negative. Next slide, please. Physiotherapy summary from this period, and this is what I said a few minutes ago. Lesson time was at home 45 to 60, mild during the weekend 90 minutes. And this information brings patients calm. She was absolutely cooperative, but use also another standard ACT. Next slide, please. Yeah, and this is development of the lung function from the period when she was hospitalized for 4 months, and she was at home. She went at home in February 2019, and you can see when we started, this is the end of the curve. We started very slowly, but very significantly was improvement of FVC in person as well as FEV1. Please, next slide. Yeah, and these findings in CT. On the left side, you can see the findings from November, and in the right side, you can see the slides from February. And what is most important, what you can see, that the February pictures is not with full of mucus, and lingula is absolutely empty, which was very, very big surprising for everybody, not for just only for us as a physiotherapist. Next slide will show you the next CF findings also. And in this slide, I would like to show you how she improved the mobility and expansibility of the thorax. And also you can see empty bronchiectasis and empty part of the lungs. Next slide, please. There is there is the results from November, compare results in February 2019, severe pulmonary improvement of atelectasis, and also this is on the right side. You can see on the right part of the right picture that the bronchiectasis is absolutely empty, which was very fine for fine information for her, and she improved, and she would like to continue the physio with the CMEOX. Next slide, please. Yeah. This is the conclusion. It's not the conclusion of my presentation, just only a few pictures, but to be objective. What helped her? He has CMEOX mobile at home. She has CMEOX for ACT, and also she has non-invasive ventilation through the Dream Station auto BiPAP. Next slide, please. And the next slide will show you, could we continue with, yeah, could you do the detail of this picture, please? Thank you. This is the picture of pulmonary function from after 10 months using the CMEOX. We started in February 2019, which is in the middle of the picture, and then you can see how FVC1 improved to the line of 80%, and also FEV1 was improved to the 60%. And the next slide will show you the pulmonary function after 20 months with CMEOX. This is one of my last slides. What you can see that the FVC is 90%, FEV1 is more than 70, not so far from 80%. And what is very important for us is also the curve of MME. F25 to 75, because we know that the down part of her lungs are very damaged, and we have to do something of everything for her good condition and improve and hold this measure, not because we know that in future probably she will have a transplantation, lung transplantation. And we have to do everything for her to be in very good condition before she will do this radical therapy. Next slide, please. This is just only the, yeah. Simonka is just now. This is the picture from last week. You can see how she is absolutely fine. She looks very well. She has a normal life. And on the right side, you can see the difference between the mucus in 20 months ago and just now 20 months with using the Simeox, which is a big difference. And next slide, please. This is thanks for my colleagues, especially for Václav Koutsky, who prepare my pyrometry lung function graph, and Dr. Hrdinová, who give me the CT founding. Next slide, please. This is absolutely last slide. Yeah. Merci beaucoup to Igoshe, who is my friend in France, and we have been friends for many than 25 years. And my thanks goes to not only to France, also to Physio Assist to France and to MR Diagnostic in Czech Republic. And thank you for your attention, and hoping that my presentation will be fine for you and will be useful for you for the next step. And my next sentence is that I am sure that AD, Flutter, and Simeox, it means that the future, not only for patients with CF, but also for the other patients. So thank you for your attention.